This presentation is brought to you by Liberty Medical, helping you to manage your diabetes and get the supplies and support you need so you can live a better life.
Good morning, Hillary. How are you doing today?
Well, I'm great. How are you?
I'm good. I'm glad to see the effects of your anesthesia have worn off.
That's good.
So, I'm pretty sure you probably don't remember anything that we talked about yesterday, do you?
No, I do not.
Okay, I didn't think so. So we're going to go over everything with your procedure again. Is that okay?
Yeah, can I have a pillow?
Okay.
Oh, sure,
All right,
sweetie.
so we did a below-the-knee amputation, as you know, as a result of your car accident. Everything went well during surgery. We didn't have any complications. You pulled through like a champ. I'm going to talk to Nurse 4 here in a minute.
Good job.
And we're going to get a kind of like a rundown on how you're going. But like I said, I checked your wound this morning. Everything was real well. I know she's been checking your bandage and changing like your compression wrap over also. So Nurse 4, how's everything looking right now?
Everything seemed fine. She was in good spirits this morning. Her
Good.
vitals were good. We checked her blood sugar. It seems all right now. And I redid her bandage. There's a little bit of seepage, but
That's normal.
Yeah, nothing that I was really worried about.
You'll have a little bit of seepage for a few weeks. That just goes on with the wound and the incision and the stitches and everything.
What about the size of my leg?
That's just swelling between the car accident and the surgery. You have a lot of inflammation, swelling going on, but that'll go down. You know, we're going to get you into therapy, and that'll help. And then when you get into outpatient therapy, and along with time, and it's going to heal, and it won't be as inflamed. So don't worry about the size.
All right.
And she had good blood flow, which I know we're really worried about since you do have that juvenile diabetes. But it seemed fine. It seems to be healing okay so far.
Great.
And I will keep you guys informed on how it's going.
Good. Okay. And because we want to get you out of here as soon as possible,
Yes.
get you back to your lovely 18-year-old life, we are going to be working closely with the physical therapist, Christine, and the dietitian of the hospital, Miss Osborne, along with your endocrinologist, who you've already had a relationship with. And in order to do that, we want to get you as independent as possible. That is our main goal here. And I'm going to be your liaison between everyone to keep everything fixed. If you have any questions about anything, you can come to me, and I can get in contact with any of them, or you can get in contact with them. But Christine, do you want to talk about physical therapy here first?
One second, I'm going to let you finish, but...
Don't do it!
Girl, what did I tell you? This is Harold's! Quit taking them! Harold here. Beat her up next time.
I like Rice Krispie treats.
Yeah,
You
those
can't
you're gonna
have
have to be a little bit more careful with those, because you have your diabetes and you're on a lot of medications.
Okay.
So, physical therapy, we're going to be doing mostly upper extremity stuff, meaning I'm just going to be working on strengthening your arm muscles and your trunk muscles, because we're not going to get you up and walking right away. I know that, I mean,
I don't
it's
have a
not,
leg.
it's not very probable right now, but you're still 18. You have so many opportunities whenever we do start fitting you for a prosthetic.
So, like prom?
Prom is very possible. You're going to go. You are going to go. You're going to enjoy it.
That is one of all of our goals, is to get you back.
That's the main goal
Good, I
here.
got
You
some
want to go to
dancing
prom.
do.
Yeah, you got some dancing. You'll be able to do it. You'll have fun. But for right now, while you're in the hospital, thank you, Nurse Warren. While you're in the hospital, we're going to be focusing on just getting you in and out of bed, to and from the bathroom. We want you to just be able to transfer and move around on your own and not need the help of myself and Nurse 4 so much. Do you have any questions on where that's going just for your week here?
So I'm only with you for a week?
Pretty much. So you'll have about a week in the hospital. We don't want to keep you here too long.
We just want to check, make sure there's no infection, there's no problem with the surgery. We want the swelling to go down a little bit. And once you get independent in your transfers, which we'll be helping you with,
we'll discharge you to an inpatient facility where you'll work a little bit more there, and then you'll definitely go to outpatient, and that's where you'll be fitted for your prosthetic and everything. But your social worker and everything will still be there with you.
Me and your endocrinologist will still stay with you through your whole process.
Yeah.
And I'm sure Christine will even call and check up to make sure you're doing okay too.
Absolutely.
Gems.
Yeah. So one of the things we are going to be watching for is while we're doing PT, we're going to make sure you don't have any drops in your blood sugar. We really need to manage your diabetes. You are aware of this.
I don't want to pass out.
So this is Miss Osborne. So she's your nutritionist. Her and I are going to work together pretty closely because she works here at the hospital as well. She'll be bringing you your lunches, and we're going to make sure that you're getting enough carbs and sugars, and that level is staying high enough during PT so that it doesn't drop. I don't know if you want to talk a little bit about where we're all at on your meals and what you're getting.
Okay, so I'm going to be working hand in hand with your endocrinologist,
And here at the hospital, we'll be providing your lunches, making sure that your glycemic index and your insulin is good and your sugars are good. We want to make sure we're keeping up on the counts that you're already familiar with, and you've been doing a good job so far managing your diabetes. So we're just mostly going to be doing that and keeping in contact with your nurse and everyone in this group of people that are going to be helping you manage your diabetes as well as the instant that you're in now.
Alright.
Yeah, because it'll be a little bit different because you're going to be on antibiotics, so we need to monitor that a little bit more closely. Was her blood sugar okay? Because I want to do PT after this meeting.
After this meeting,
yeah.
it was good. She is about to get lunch though after this meeting.
Okay, so after lunch.
She has to take all of her stuff.
Okay,
so
that's a good
Would
time.
that
should
be
probably
okay
wait
with
till
you?
after
How's
Yeah,
that
that's
sounding?
working fine for me because we
I
managed the
didn't eat the Rice
diabetes.
Krispies treat.
We managed
Okay.
Didn't eat it.
Good.
You didn't sneak any other ones though, did you?
No.
Okay, we're gonna have to
I'll-
watch that.
I'll check later.
We
I'll
need to
check.
watch that.
So you're good with your ratio. You're doing the 100 over 20. Perfect. You're a champ.
Yeah.
And then at lunch, you're going to take your 32 units of Lantus, so like bolus yourself, okay?
As long as my lunch gets here on time.
No. Can
Is that
guys
you?
make
Is
sure
that
that's
you?
you?
Okay, all right.
Okay.
I can go check on that.
Alright.
Okay, thank you.
We're going to get it. Diabetes. Diabetes. Okay.
So,
Wow,
do
nice.
you have questions for your social worker?
We realize that there's also a social and a psychological aspect that goes along with this, but we are here for you for that also. All of us are here for that. So if there's nothing else you have, we're ready to start.
Yeah, I'm
therapy
gonna
after
first
your
make
next
sure you did change her dressing, correct?
Yes, I just changed it about 10 minutes.
Okay, I want to make sure. One of the other things we're gonna make sure. Whoa, you okay there?
Yes,
Okay.
hospital.
We're gonna make sure that you have no complications with your incision. Like Nurse Borer said, it looks good, but if there's any problems or any inflammation, I'm definitely gonna come back to you,
Contact
Dr.
me.
English.
We'll take a look at it. We'll make sure everything's healing properly, like we said. We'll make sure we regularly change your bandages and everything. So just keep in close contact with us.
Yeah.
All right.
Do you have any questions for anybody?
No, I'm gonna take a selfie.
All right.
But first, let me take a selfie.